Souple, mandez pour moi si c'est ici qui c'est PCVI 550 West Merrick Road, Valley Stream, New York 11581. Nous traitons.
Oui, nous qu'a fait sa famille. Oui, nous qu'a fait sa famille. Oui, nous qu'a fait sa famille. Oui, nous qu'a fait ça.
C'est glauque comme fait manger. Ou qu'a
Oui, nous qu'a fait sa famille. Oui, nous qu'a fait ça. Nous qu'a fait ouais.
Cataracte fait pas qu'à ouais qu'on sous qu'a
Nous qu'a fait ça.
depuis cycle la prend, pas ouais ménager comme si pourtant tension j'aime toujours à monter descendre.
Nous qu'a fait ça.
Nous capables pas gros côté opération ouais. Qu'on y a là ou posséder depuis la peau.
Oui, nous qu'a fait ça.
La journée mouais. Depuis l'angélisme pas rien pour
Oui, nous
qu'arrêter.
qu'a fait ça. Nous qu'a fait ouais.
Depuis au monde devant moi morceau pas un
Nous qu'a
morceau.
fait ça.
Comme si tout bon nous qu'arrêter.
Nous qu'a fait ouais.
Eh ben nous même ça nous ici.
Nous qu'a fait ça.
C'est vrai.
Nous qu'a fait ouais.
Bon ça nous y est depuis me venir là. Ma point.
Good evening, good morning. I don't know where you're located. If you're in Arizona, most likely I would say good afternoon. Or if you're in California, but if you're in New York, that's good evening. As a lot of you may already know, this time is the time for me to talk to you about, this is your show, the show we call Healthy Vision. And just to let you know, next week or following next week, we will have a course because a lot of our fans was asking us, well, I want to hear a female voice also. We will have a female voice that will be with us, if it's not next week, following next week. Now, yesterday in the show in French Creole, we talk about diabetic retinopathy. But tonight, we're not going to talk about that because we are in the United States. And as you know, October is healthy. It's not only healthy, it's eye vision, is eye care prevention. October is Halloween safety month. A lot of people may say to me, why Dr. is talking about Halloween? What Halloween have to do with low vision? What Halloween may have to do with blindness or eye? Of course, yes, because you're going to see throughout the show. I don't want to tell you because there is a lot of surprise to this show. Because October also is not only Halloween safety month. October is home safety month also. When I said home, it's home eye safety month. And October too, this is in the beginning of October, even if it's past, is whole side day. That was October 10. That means there is a lot happening in October. And as I'm doing this show, I always try to do, when I talk about Haiti, because that's where I come from. That's where I was able to do my medicine, get most of my knowledge. And I always try to do a little comparison with the United States. Because if we, on October, we celebrate Halloween, in Haiti, most likely we celebrate it in a different way, but most likely that's in November, at the beginning of November. And hopefully, in Wona Leon show or in Santi Visual show, you will be able to see more of that. But in the United States, like I always said, this country, they focus on human resources. And they really, because the base of this country, any form of disability you may have, there is always study. There is always something that can help all these people, whatever form of disability they have, to be able to cope with their reality, to be able to do what they're supposed to do, to be able to to deal with the daily living environment. And all that to say what? Because Halloween Safety Month, American Academy of Ophthalmologists, think about it. American Academy of Optometrists, think about it. State agency like American Foundation for the Blind, think about it. And National Federation for the Blind, think about it. I will say this is what is not. I know this is a democratic country where people, whether your faith, some people may don't believe in Halloween, some people may don't celebrate Halloween, but that doesn't prevent, you know, the country celebrate. That doesn't prevent the country do what they're supposed to do. But those institutions I just talk about, what they do some research, and through the research they see what happened to this month. They see during October, this is the month a lot of injury happen to the eye. A lot of people get injured to the eye, either to the house, either at work. That's why the American Academy of Ophthalmology say, come for this month, they provide some tape. American optometrists provide some tape. We have a lot of picture. We have a lot of information we're going to share with you, because this show tonight going to be in two segments. For the first segment, I want to share it with you first. I don't want to keep talking. And I want you to see the little piece what we prepare for you. And like I said, I have to give credit to where I get all this information. When I get the source, is to the American Academy of Ophthalmologists, is to American Foundation for the Blind, is to Salis University. But I want to share some of the information for you. As you can see, this is what we, but this is the beginning because we have some more information for you because this is a Halloween safety month. Uh, we prepared that for you because Halloween is a, you know, it's depend of your faith. Some people, everybody, because in United States, there is so many different people. A, a lot of people celebrate it in a different way, their own way, because some people use this as a fun. This is a day the kids love. They go for candy. They go to house, and some people this is the way. This is a day they use. They identify themselves as a with different hell, different different people like they identify themselves. But in the same time too, doing you when you celebrate doing Halloween, you don't want that to be a nightmare for you. When I said just one night, and you can see a lot can happen. Or that a lot of people said, "Oh, how can that happen? I'm just wearing any different clothes." But guess what? As you see these days, a lot of people try to use different type of contact. That's why October is is contact is a I say is a contact safety is a day where all eye care provider, all medical practice that focus on vision, they focus on the eye. Like you and in this is the day where we most likely focus. We don't want you to go on any store and buy a custom made contact. This that by the way, it's illegal, and in United States, the FDA consider they consider the all contact lens, all these contact like a medical device. You need to have a medical. You need to be licensed, and whatever the store, you need to get if you have to get this thing, you need to get it from your eye care provider because research show, um, believe it or not, although people enjoy themselves, a lot of people get injured while they're at the house. Specifically, if we go as far the home safety in your house, doing research that we made, 90% of these people, 90% a, of people that celebrate Halloween, when I said people, a lot of them may injure themselves. But out of 90%, that was a research, a 125,000 injury are reported every year. And this is not a joke. When I say this is not a joke, a, if 125, you don't want to be part of it. We are not decide to just do a show like this on Halloween. We are doing it because as a icon provider, this is a time for us, and also I say to because a lot of people want to hear what we say, because I'm sorry because I know some of people fan that watching this show last time what did talk to us about this, but we know the people that's what they should want to hear, what we are saying. We want to you they want to hear what what we are saying, and what we were talking about about this show now is about the Halloween. The Halloween, this is a day, if you're going to celebrate, you need to at least make sure if you're going to get any form of contact, you get it from your eye from your eye doctor. If you have your kids, if you have any kids that's going to go out, make sure they don't use anything that can block the eye. If you're going to use anything you're going to use in your face, you make sure you don't get any product chemic that can attack your eye. I'm going to give you a little story, because in 2016, what happened in the United States, there was no, I will not say the kids, a patient, that have that buy contact during Halloween situation, but they did buy the contact without any eye care provider prescribe this person anything, and this person has this contact in the eye for over 25 years, and a lot of you may ask, "Oh, that happened," but this person in their mind they think the contact just fell out because the person didn't feel it in the eye, but from time to time this person has a little infection, until after 25 years, when the person has what the upper lid, it dropped down, and the person keeps having severe pain. And when the person went to see an ophthalmologist, this is the time the ophthalmologist found out there was a little schism. There was a little schism, like a mass inside the eye. And when they look at it, they saw there was a piece of this contact that's been there for a long time. This person didn't even know what's going on. Now, we don't want, you can see, and this person was lucky, and the ophthalmologist was able to remove it, and but even this person lost some of the vision, but this person was lucky, this person didn't go blind. But we don't want that happen to anyone. Now, this is a state law, as we said for the when we were talking about the white can, and same thing for contact. If you're going to use contact, I know there is a lot of online store that sell contact, and during that day, this, if I believe or not, Halloween day is a day people, when I say people, it's because in America this is a capitalist country where everything you can make money on it. And now this is a day too, even people celebrate, even people do whatever they do, this is a day too. Some of the business try to make some profit also. And when they make this type of profit, now you as yourself, you have to make sure you don't just go online in any store, you just buy contact. You make sure your doctor give you a prescription. You make sure, if it's your first time, you make sure you get the proper feeding. And it's not like I'm trying to do marketing for the doctor, stuff like that, because this is our job, because this is a state law. As a low vision and blind rehab facility, we don't want you, because last year we received like a 3 or 4 cases, as we said that in the show yesterday. And those cases, these kids lost a lot of days from work before they can go back to work. Why? Because of contact, because that was the first time they didn't have any prescription, they don't have anything, and that's why they have all this issue. Now, we don't want that all these things happen to anyone, and specifically the fan of PCVI network. We don't want that happen to any of you now. Now, for the kids. Now, if we talk about all these people through the show, we have to talk about, because we low vision and blind facility. Don't take people that lost the vision or people that completely blind doesn't celebrate a Halloween. They do also. Now, for the kids, for some of the kids that have some form of vision, what I want you to do, even they don't see clearly, you make sure the parent give them a flashlight. You make sure you can show them when they're walking at night, they don't have to fail in anything. And at least with the flashlight, they would be able to see a little bit. Now, for the kids that are completely blind, the good advice we're going to give them to Healthy Vision Show, if you don't know where you're going, if you don't know the neighborhood where you're going, you are not have any familiarity with where you're going, is best. You contact a state agency. I'm talking for the people in New York. You can contact Vision in the city. You can contact Ellen Keller, and you can contact the Press Center also, because we have a certified orientation mobility specialist that can help you. And if you are in any other state, you can, if you don't know who to contact, you can call the Bureau Service for the Blind in your town. If you don't know, just Google it and see and ask them, because if you don't know, or if the kids is not familiarity, it doesn't have any familiarity with the environment, they can have their parents show them the road where to go. But the safe aspect of it is get a certified orientation mobility specialist, or someone that's well educated as for that deal with vision loss and blindness, that can help this person be able to move safely, independently. We don't want anything happen for them. Now, for some of the kids that may don't have vision loss, that may have other form of the disability, but make sure you get in touch with a professional medical that can help you, because we want everyone to celebrate this day. Now, a lot of adults may say to me, well, what's on it for us? For us, because we celebrate as adults. Every year I celebrate, I don't have anything. Guess what? Don't try to, I know there is a lot of candy eye. There is a different eye. There is a blue eye. There is a cat eye. But there is good news. The good news, you can use this contact, but you have to get a prescription for it. You have to get it from a licensed provider. And make sure you get your prescription for your doctor. Make sure wherever you're going to buy this place too is a licensed place that's authorized to sell it to you too. This way safely you can use it. Now, we have a lot to talk about tonight. What I'm going to do with a lot of these pictures we have, I'm going to share some of them. I'm going to explain them to everyone, because I may be talking. A lot of people may say, well, I'm trying to understand Dr. Prince, because, as you know, we have accent. We come from a French country. We don't expect a lot of people to understand what we're talking about. We don't expect a lot of people have it easy for them to understand. But that's why we do this show together with a lot of picture. And we're going to do do it slowly. We're going to I'm looking at the time, and I see they asked me to take a break. But before I take a break, I'm going to finish on this. As the American ophthalmologist said, don't let the Halloween, the fun day, become a nightmare for you. And make sure the tip we are giving you, you can put them in application. We're going to take a break and we'll get back shortly.
Prince Center for the Visually Impaired is a state-of-the-art facility with low vision specialists for all your vision needs. Our low vision rehabilitation specialists will accurately measure your visual capabilities and help you use it more efficiently. Please call us today for a low vision evaluation at area code 516-200-3850 or stop by our local office located at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Do not assume your options are limited to surgery or glasses, and do not wait until you are legally blind to benefit from our services.
Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Vision loss can greatly affect one's quality of life. However, there are low vision devices and technology that can help patients maintain a functional quality of life. Prince Center for the Visually Impaired specializes in helping patients find the right technology for their specific needs. For more information, call us at 516-200-3850 or stop by our office at 550.
Okay, we are back. And as you can see, even you don't see my, I believe it will be best. We have a lot of friends that watching. I'm going to say, Shirley Toma, thank you for watching. And we're doing this show in English for you guys because I know a lot of you are watching this show. And sometimes we have this show in Creole, in French, you don't understand. And that's why we designed, we have this specific segment just for you. And I know, Shirley, I know you celebrate Halloween very well. You with Deborah, with Barbara, you guys celebrate a lot. As you can see a lot of picture we are showing now. And now those picture, what they are is picture. You may be a lot of people that watch the show may be familiar with this picture, with all this picture. Now, what we try to say to everyone, eh, there is a lot of we when we identify ourselves, we most likely focus on the vision aspect, like wherever we get the contact. Make sure we said a lot about this, and as you can see, the super not superstar, just musicians stuff like that that show on the show, and is make sure when we get the contact we can get it from a licensed professional. Make sure it's safe. Make sure it's a correct prescription for you guys. Most likely is I know it's Michael Jackson. I just didn't want to say the name. And as you said, even if you have your dog, some people sometimes identify themselves as a dog, and a lot of people even they have any animal in the house, either a cat or dog. You know, make sure whatever product you use for them, you make sure they don't get inside the eye, the chemical product. You know, or you can prevent those chemical product get inside the eye. So it's by protecting the eye. Like you see, as you can look at this picture, this is a contact someone has, but this form of contact block all the vision. But you don't want to use anything that can block your field of view. When that block your field of view, you can bump onto things. It's like the same thing for this person that use this eye. You know, I know is a good identification for some people, but you don't want to block anything that can block your field of view. And when that happens, any injury can happen. We try to prevent that, and with to the network, we are focused on prevent this happen. And as for the next picture you're going to see now, um, let's see the next one. Um, it look like okay. The next one, and as you can see, like for this picture, is someone inside his house. Most likely, October is Home's Eye Safety Month also. When you in why we talk about stuff inside the house, because there is a lot of injury that's been reported and that happened in the eye by people walking inside the house, and either for adults, either for kids also. If some kids, even based on the type of toy you provide them, you give them to play based on whatever what you give them, you have to make sure their eye is protected. You have to make sure what you give them is protected. As you can see, this picture is some of the kids that's going to go for candy. But now, for most of these kids, and now we already go to another picture. Because it's October Eye Safety Month, we don't only focus on Halloween. That's why you see that sport, that football player. We advise everyone, you know, try to protect the eye. You know, even if you play with someone, if you're going to play defense, whatever you're going to do, don't try to do it with your finger. Now, as you can see this picture, this person and has a well is identify himself or herself nicely, but as you see the protection, this person, good for this person, the contact this person has is a prescribed one. You know, now only thing we'd say to you when you use any contact lens and is get it from a correct prescription, from a licensed professional. You don't want to get injury like this person that just get a contact in a store or online, and guess what happened? Sometimes the you see all the, or if you look at this picture, you can see all the a contact is going one side. It's not like the person is looking inside. It's just the contact is completely outside the cornea. You don't want that happen. When that happen, any injury can happen, a infection can happen. Sometimes you may take time, but if infection happen, that will be a big issue for you, because you will take time from work, and you will if you take you may even lose your vision. We don't want that happen. That's why we just focus, because even what we're doing now, because a lot of research prove a lot of those things happen because of careless situation, because people can avoid this situation by using the proper eye protection, and if they know what to do. And we already talk about the for kids that lost the vision. We talk about also. We already talk about to the kids that blind. They all celebrate the Halloween also. And now we have a second part of the show. Because we just take a long break. We're not going to take a long break. We're going to go straight to the second part. I'm going to we just watch a little thing we prepare for you. Just listen to them, and if you have any questions, you can always send the question, like all a lot of fans do to our network. They can do it while we live, and they can do it also. They can do it also to email to us also, and we're going to. We're going to have a meeting to As you can see, this is what we did prepare for you tonight. Um, Even if you look at all this picture, you may look at all this preparation. We get this picture from different websites. We have to give credit for this website. We get them from the American Academy of Ophthalmologists website, as we said earlier. We get them from AFB, American Foundation for the Blind. We get some of the picture also from American Academy of Ophthalmology, of optometrists. Now, this October is eye safety month. In October, and we don't decide to call October eye safety month. Every month is something, but the reason they baptize every month as a specific matter, because if someone is in the medical, is a nurse or if it's a doctor, if you ask them what October means for them, yesterday I see some sites talk about the that was the medical assistant day, and you may see, if you're based on your profession, if you're a lawyer, if you're whoever you are, they use this day as special day for the profession. Now, October, as for eye safety months, this is something that happened for a long time, because research done by a lot of eye care provider, a lot of eye care specialists show during this month there is a lot happening with the eye. There is a lot of injury. All these injury happen too because there is a lot going on. Not only in the Halloween situation, but this is the time kids in schools. As for adults, there is a lot of celebration also, and we want to make sure everybody know what they ought to protect themselves, because we don't want you to be part of out of what of 100, 1,500 people that have their eye injured during Halloween. We don't want that happen to you guys, and that's why we this make this all this video just to remind you during that day you celebrate, protect yourself. And now you can see in front of me I have some protection, some they look like some sunglasses, some cocoon lens, stuff like that. If for some of the people that doesn't have them, you can make sure you get something like this. You can protect your eye. Even it's not only when you're going to celebrate. If you're in a house, because you can see some of the picture. I saw someone is cooking while Dr. Prince is showing this. Yeah, because some people get injured, stuff go to their eye vision while they're cooking. And also remember, people that get cataract also, the risk of cataract increase most likely. Heat is a risk factor also. It's good for you to protect yourself that way. Now you can see because I have one of our colleague that was watching, that just said to me, um, well, eh, one of the pictures should not be here, but because he doesn't know, because he saw someone walking with his kids, doing some homework, inside home, because October is home safety month. This guy you see he has a goggle on his eye. He has a protection. Nothing going to get inside the eye. And what we're doing here, we want to make sure or every employee, every people that work at the jobs, we try to do the same thing. Now, the Department of Health of Education is required, the Eye Institute a that require for us to use this month to talk about eye safety, or you can protect yourself. We are giving you those we are giving you free advice, and I always say that a lot of people, most likely I'm talking about the Asian community, most likely like to listen a political matter, most likely political stuff. But this stuff, this information we are giving you, you need to take time to get them, because if you don't have time to watch, if you're not on Facebook, I believe or director of information of the director of the network, Ronald Leon, and we'll send the information to you to WhatsApp everywhere. Now, if you don't have WhatsApp either, you can watch it on channel 114, because we have 2 hours. You can watch the show, and the English show and the a Creole show also. Both of them every Friday on channels 114 at 2 p.m. If not, from 1 to 3 p.m. You can watch them, because we give free information. We want to make sure we can use this platform to educate you. It's not only it's not like to force you to come to the press center to get your eye checked, but press center is dealing with a lot of people with vision loss, with blind people. We don't want that to happen to you that way. That doesn't mean some people may be born with blindness, stuff like that, but they cope with the reality. Even we can get you back on track. We try to prevent that happen, because October 10 was what they call the World's Sight Day. What that means? This is a day, the people from the Lions Club International, and since 2000, I believe since 2000, they use that day, and the goals is try to prevent blindness, diminish, reduce, amount of people that can go blind to those type of situations, to any form of injury, or not having the information, because what they found themselves, a lot of people have cataract. They don't check the doctor. They don't go to see doctor, stuff like that, and they go blind without know. A lot of people has glaucoma. They know about it when they're already blind, and a lot of people may have any form of infection, like the case I explained to you early, and the lady that have a contact for over 25 years inside the eye. This person didn't even know until there was a little tumor inside the eye. When they saw the ophthalmology, they will figure out what's going on. When they do the MRI, they saw something, and when they put it out, they found it was a little piece of contact that was inside the eye. What guess what happened? Because this person didn't even just get the contact. She didn't get it with someone that's licensed, or she that to a store that authorized to sell contact, because as you can see, all the store that well authorized to sell contact lens, most likely this store will ask you for prescription. If you don't have it, you cannot get it. But we know during Halloween, a lot of people will try to get this thing online. But you can do whatever you want, but we want to make sure you know how to protect yourself. We give you the information, put it in an application, because I know in 2016, the IC people, this is a federal matter, and they did arrest someone. That was There was so many contact that was coming to the United States without authorization. The whoever that was the type of this product were going to, they arrest this person for 46 months in jail. This person spent. This is not a joke. And because, as I said to you, for people that doesn't know, FDA, Food Drug Administration, consider contact lens as a medical device. That means for you to get it, you need to get it from a licensed provider. Now we keep saying that, we keep repeat it, we keep repeat it. We want to everyone, because we know a lot of people can have blue eye, red eye, cat eye, and stuff like that. All these steps we just show you, we want to make sure you put them in application. You want to make sure you know how to protect yourself. Now we know there is a lot of people that may just get to the network now. Now we have to talk about, because as a Prince Center, as a low vision and blind facility, we cannot don't talk about a the kids that's completely blind, or the people that completely blind. They do celebrate Halloween. We have some tips for them. You know, if you lost your vision completely, if you don't lost your vision completely, you have some form of vision, make sure you use a flashlight. Make sure you have some light, as you celebrate, as you're going out. Or if you're completely blind, make sure you know where you're going. If it's your kids, make sure the kids know the area. The kids already get some form of familiarity with the area. Now, if you don't know how to do it, make sure you call a state agency. Make sure you call the Bureau Service for the Blind. Make sure you ask a eye care provider, where can you get a professional that can help you deal, be mobile independently, safely and independently, without get injure yourself beside your eye, get something on any other issue with your condition. We don't want anything happen to you. Now, uh, we see Whiskey Willie is on the show. We say thank you for watching, and we see Kevin Genty also. We say thank you for watching. But any show has a beginning and has an end. This show was not easy for us today, and for whatever happened during the show, and we may apologize to some technical issue. This is a new network. It's a working in progress. We still try to do our best, and that's why we can only say to everyone, just be patient, because we will find the right technician usually that can give us what we need. But in the meantime, as a trial period, we can do whatever we can. And we thank everyone, and I will see you next Tuesday. Sorry, next Thursday.